So I worked on a webinar, and the purpose of the webinar was to talk about polypharmacy and medication management in older adults with cancer. At my institution, we've actually done a number of research projects that really focus on medication management in this particular population. Our research shows that over 80% of the patients that are seen at our center are taking 5 or more medications, and over 80% of that population is taking 10 or more medications. So we know that polypharmacy and medication management is a huge problem that disproportionately affects older adults. Not only is it based on number of medications, but also with each number of medication that's added, we know that patients are taking high-risk medications that can increase their risk for adverse drug events, such as falls, hospitalizations, and things of that sort. So my role in the clinic is really to look at the medications that patients are taking and then identify ways in which we can optimize it, either by reducing number of medications or by reducing the number of high-risk medications that patients are taking. So I was fortunate enough to participate with ACCC on this advisory committee, and we've had great participation in terms of the number of participants that have shown interest in the webinar. So I think we are grateful to know that people are engaged and that people recognize that this is an emerging issue in this particular population. I think that next steps are to identify interventions that can be applied to a variety of organizations and institutions so that we can find ways to intervene and to address this issue of massive number of medications that patients are actually consuming and self-managing. So the reason that I participated is because I'm fortunate enough to work at the Senior Adult Oncology Center at the Cindy Kimmel Cancer Center at Jefferson. So we are a unique center in that we are an interprofessional care team. So the team consists of the medical oncologist, the geriatrician, the pharmacist, the dietitian, as well as the social worker. So we have a very unique model in that patients are able to be seen at our center and to touch each of these different experts so that we can come up with what we believe is a tailored treatment plan for these patients, knowing that these patients have different areas of vulnerability. And we believe that this type of interprofessional care model can optimize the care that these patients are receiving. So that's the reason why I wanted to participate in the work that ACCC was doing. So ACCC has a series of resources and documents to help support institutions as well as practitioners to be able to manage patients. So on that particular website, we have documents that talk about screening for high-risk medications. We have papers and publications that focus on medication management and polypharmacy. So I think that there's a wealth of information, tools, resources, guidelines, papers that can be found at the ACCC website.